While parents are encouraged to love whatever gender they birth, we can't take away the reality that some couples have had 4 or 5 sons or daughters and just want a child of the opposite gender to complete their family. We call that family balancing. And here are 2 methods to help you get the son or the daughter of your dream. The first method is called the Erickson method, and the second method is called pre-implantation genetic diagnosis. I'll quickly explain the Erickson method for you. Dr. Ronald Erickson was the originator of that method. What he did was he put some semen in a test tube and added water, and he put it in a corner of his laboratory. And after some time, he went to check the semen. He noticed that the semen had divided into 2 portions, 2 parts, an upper part and a lower part. And he also discovered that the upper part contained more of the male sperm, what we call the Y cells, and the lower part contained more of the female part. Now, the reason for that is the male sex hormone, the Y, is usually smaller and it usually swims faster. The male, which is the female, which is the X, is usually denser, that is bigger than the Y sperm, and it swims slower. So when he put the semen in the test tube bottle, he noticed those changes. And what he did at that point in time is, if you said you wanted a boy, he would take sperm from the upper portion and inseminate into the woman. And if he wanted a female child, he would take sperm from the lower portion and inseminate into the woman. And he had like 70 to 80% success rate just with that method. But what had happened over the years is there are even better ways of separating semen in an IVF laboratory. So Erickson is one method. But the thing is, you cannot be guaranteed 100% success with Erickson method. At most 90%, but there's still that chance that it might not give you the desired child that you want. But it's more than the 50-50 chance that you will have to go through if you had sex naturally. The second method, which is the pre-implantation genetic diagnosis technique, is more accurate. I just don't want to use the word 100%. It's like 99.9% accurate. But it's more expensive, and you will have to go through an IVF to be able to access that particular technique. Now, what happens during that technique is, once the embryos have been formed in the lab, that is, the egg and the sperm have already fertilized and they formed an embryo, a portion, a biopsy of the embryos are taken out and they are going to check in the lab. And one goes to the lab to check them. From the genetic test, you can know whether it's a male embryo or it's a female embryo. And then you implant the necessary ones, whatever the couples want. Like I said, it's like 100% accurate, but it's also expensive. Because apart from paying for your IVF, you have to pay for the PGT or PGTA, as we call it now, separately. The drawback, again, is there's no guarantee that your IVF will be successful. But if it is successful, you can almost always be sure that it's 100% going to give you the desired sex that you want. Both of the techniques are available in our clinic. If you've enjoyed this video, kindly like, kindly share, and if you have any questions regarding sex balancing or family balancing, contact us. Thank you.